And to keep things very simple, starting on January 1st, if nothing happens between now and January 1st, Medicare is no longer going to pay for patients to be in their home. They would need to be in a HPSA, underserved area, meet the requirements of the FQHC, the RHC. They need to be in one of those originating site eligible areas. And then the only exception to that would be the behavioral health, substance use disorder, or the ESRD clinical assessments. So January 1st, if you're in your home and you're not in one of those areas, Medicare is not going to pay for the service because of the originating site restrictions. So a lot of people don't know that that's what it is. It's the originating site requirements that are embedded in the Social Security Act, which is why Medicare does not have the authority to change the requirements. They can't change the Social Security Act. Congress has to do that. Originating site is also commonly referred to as the spoke site. And so prior to the pandemic, most of the time what was happening is patients would go into a clinic like a federally qualified health center or a community mental health center. And so they would go in there and they would get set up in the clinic with a provider that would then be dialing in via telehealth. And so then let's say the mental health provider would be dialing in. And so they would be at the clinic and then they would be seeing the provider via telehealth. And so in that instance, the originating site would be eligible to bill for the facility fee for telehealth. What's been happening a lot is providers and organizations are billing for that Q code, the originating site, the facility fee, and they've been billing for it improperly and getting paid for it. Meaning if the patient was at home, there's no originating site facility fee because they didn't come to your office. So just keep that in mind. That's what the terminology means. And before the pandemic or the public health emergency, Medicare patients had to be in those originating site areas in order to meet the geographical location requirements for telehealth. So through December 31st, 2024, all patients can continue to receive the telehealth, regardless of where they're located.